Good afternoon, everybody. We are here again to address, I think, further questions and answers. I know we have been asked where we have been the last 2 days. I think trying to keep busy. I mean, work hasn't really stopped. I have a little brief remarks before I ask Dr. Russell to go through the listing of the further tests that we are getting, and some of them are coming out in real time in that regard. Uh, just to say that we have to thank the multiple stakeholders in terms of the ongoing support we continue to have. And I am seeing lots of business entities calling us and saying, this is what we are able to support you with. I just got off the phone with somebody who is saying we can help even with perhaps isolation, those kinds of things. Just so you know, I was just trying to track down where the further testing areas kits are, and have 5,000 individual test kits slated to come in. Those are already paid for. 7,300 PPEs, those are already paid for, and they're on their way. The 6 initial ventilators are slated to arrive today. We have just signed on to a document to procure test tubes, which are materials used for the actual swabbing and blood samples that are needed to be taken for the study we are undertaking. That is, I will give you a total monetary value so that you can also appreciate the cost this has. I know people are saying about the initial budget given of $900,000. I think we have gone beyond that, maybe from last week, if not before. But we just paid $93,000, or going in the process of paying $93,750 for test tubes. From one source, we are paying $36,500, and for another source, $212,600. This is for a total of 20 more ventilators. 6 X-ray machines are scheduled to arrive, portable ones, next week, and I know we are getting 2 portable ultrasounds also for use in that regard. Notwithstanding the multiple stakeholder engagement that we have had, I think one of the key areas we need to continue to indicate to others is that we really need to stop spreading the rumors. We really need to stop avoiding panic on the one hand, and on the other hand, people making a mockery of the response and making a mockery of the quarantine self-isolation situation. Why? Because people are still up and down the street. People are still doing activities that they are not expected to be doing. Understand that under the quarantine measure we had mentioned that there's self-isolation, that if that doesn't happen, you can be fined and you can be put in prison, and this clearly articulated in the quarantine measures that we set out yesterday. One other thing that I need to clearly stress out for people is that our health staff has now come to be aggressed, at least in 2 communities. And I need to say that because we are aware that in San Ignacio particularly, and in Corozal, we are being told that health staff is not being allowed to go into the stores to get their groceries. We are being told that people don't want to sell them food, even though they are doing their routine work schedules. And we have even issues with transportation, where taxi drivers and bus drivers are not allowing health staff to get on board, are not being picked up at all. And we really do not expect that to continue to happen, because we are expected to carry out our functions. So that's, if we can call out the community that this is not the time, I think, to be isolating health staff in that regard. I'm going to ask Russell to give us the update in terms of the tests that are available, and then I'll come back to what it is that we need to do on an individual standpoint in terms of breaking and containing the particular index case and the secondary case we have had as a result. Because I think there's people are expecting what we are doing as a Ministry of Health, what the government is doing, but we also need to be able to identify what our personal plan is if we're going to be able to contain COVID-19.
Hi. Good afternoon, everyone. Up to date, and currently in real time, we're actually processing an additional samples for COVID. To date, we have actually screened 86 samples for COVID, of which we know that it's the same two that have remained positive, the index case and her immediate contact. We do know that areas of being screened right now, we have 3 samples that were screened from Belize City, 3 from Corozal, and 1 from the Stan Creek district. So 4 of those are already negative that we're seeing, and the other 3 are actually being run right now. So that's what we're waiting on. So that's just to give you an update of what all we've been doing. Of course, there is ongoing testing for additional influenza viruses. That's ongoing as well. But particularly for this case, for SARS-CoV, COVID-19, this is the amount we have tested so far, 86. And the 4 for today remain negative.
The other situation, because I know that people had asked what happens in terms of the clinical situation with the patients. I am told that the index case, the first female, is actually had a fever this morning, doesn't have any other flu symptom. And the mom, and I can read textually what I got from the person who does FaceTime with her, because we are monitoring her other chronic conditions. It says no signs of symptoms, no fever, slight stuffiness in the right nostril. I'm reading it textually, that's how I got it. And she indicated to the person who was doing FaceTime with her that she had slept like a baby. So that's pretty good news in that regard, because at the end of the day, what you want to minimize is mortality. Also, people had asked how long before they are declared COVID negative, because you see how the mapping is done in terms of when people are positive, when they are negative. You would have, that's 14 days after we do the initial swab, and you would have to have 2 negative samples consecutive before you are declared a negative case in that regard. And I'll read from my notes in terms of what the call has been from WHO, in terms of what it is that we are able to do as a country, as an individual, as a society, in terms of containing COVID-19. One, the first call is you break the chain of transmission, which means you identify your cases, isolate them, and try to prevent any further spread. Continuous education of the public, which is what we're trying to do every day when we are here on any other means. Expand surveillance. I think that has happened. Some of the samples, for example, that are being processed really don't seem to have a strong COVID-19 tie, but because we're trying to expand our surveillance and testing, those tests are being run. Isolate, treat all cases accordingly. The index and the secondary case are isolated, no specific treatment. They don't have any frank signs and symptoms. Contact trace all possible contacts. That initial mapping was done, and I think 8 samples were done from the index case or in terms of testing. Understand that this is an all of government, all of society approach, and I need to stress this because it isn't just a Ministry of Health issue. This is everybody needs to be on board in this regard, because I think that's where we are kind of missing. Business sector, I think, has come on board in that regard, but we all need to do our part in this regard, because we need to understand that this is not going to be business as usual from now on. I think our lives have changed forever, and if you see what's happening around us, particularly in the US, that now has the majority of cases, more than China, they are not expecting to go down with their cases perhaps until July, August, and that's, you're talking about the next 2, 3, 4 months. So even if our airports were to open, I don't know that you're going to be having any flights in that regard. So understand the potential effect that can have, and that's not scaring anybody, but I think it's putting it out so that people can understand where we are and where we are expected to go in that regard. The usual precautionary personal measures: washing your hands, not touch your face, cleaning surfaces regularly. If you are ill, you should be isolated. Respiratory etiquette. And patients older than 60 years should really ensure that their chronic diseases are well controlled. Those should really be even further away from social gatherings. When you review the data in Italy, 95% of the patients that have died are older than 60 years. It doesn't mean it doesn't kill younger persons, but I think we need to zone into that specific situation. In terms of anxiety, also we need to be able to self-educate in order to be able to stay safe in that regard. Before I go on to my other notes, in terms of what you do with our opinion on lockdowns and those kinds of things, I think we can start answering some of the questions that are popping up here. Anyone who catches the virus and does recover, can the person catch it again? There's data that says you can catch it again, but then there's some data that's suggesting that perhaps the person had not really recovered from that first infection, and that's the reason why they showed up as positive later on. What intensity of UV kills it? I don't know if I have seen that, and I don't know how you'd be measuring UV other than those little gadgets, but that's not a reason why you would say, okay, I'm on the specific UV and that's gonna kill the virus. Will there be curfew to spread people off the street at night to stop the spread? Well, with the quarantine, most of these areas are closed now, or should be closed. And I say should because I know people are still going to try to sneak up, not on us, on the entire society, because people assume that they are doing this, hiding it away from the Ministry of Health, but in reality it's our collective responsibility that we have here. I think if eventually it needs to go down, that's not a decision we will take. It's a recommendation we can make if the quarantine measures that we have recommended and enacted from our end are not adhered to. But if you look at the quarantine measures that we set in place, that pretty much puts us in a distant kind of mode until we're able to ascertain whether we have any other cases that are potentially there. Understand that we really have isolated ourselves. I mean, the Guatemalan border closed now for more than a week. The western border, the border with Mexico closed. Tomorrow is a week. The airport closed on Monday. Understand that if there's anything, then it's really brewing from either a Belizean that came back or was in contact with somewhere else. But so that's the reason why the next 7 to 10 days in this first phase are going to be critical in terms of being able to identify any other case, if that were to be the case. Will the San Pedro Polyclinic be given any of that equipment for the island? Yes, they actually have their PPEs, as I had mentioned in one of the previous Q&As. The doctor who went to take the swab assured us, and he ensured that he had the proper PPEs, and he is the actual one who did the swabbing for all the other cases. So I mean that is there for them. Is it not problematic that people are being charged for not being self-isolated if they catch COVID-19? Does this not encourage people to lie about their actions and whereabouts and making mapping a lot harder, or even make people not report their symptoms? I think we stressed that the first time we identified the case. If you notice, we did not say, we asked that people stay put, if you will. We asked that people stay in the island, don't move from there. That didn't work, then you take a stronger measure, and then you realize that that's still not working, and so you have to take extra measures as you go along. So that's the reason why, even though San Pedro was declared as a state of emergency abruptly because we felt we were losing track of that, is the very same reason why the quarantine measures are being set in place. So drastic and draconian measures will always have people trying to come back and beating the system, if you will, or going behind the system to get that. I have some other questions. I'll ask Russell, you might have this data. It says, what is the age of the second patient? What is her number of contacts? And the total combined number of contacts for both mother and daughter.
Yes, I guess from the initial mapping that was carried out, when we did for the first, the index case, we did get back about 8 to 12 individuals who had direct contact with them. That is inclusive of the family members as well. Of course, with that first mapping, we were able to detect the immediate contact in this case. For that person, we do have it's an individual who's over 65, so it's somebody who's there. But we do know that she is right now very stable, Even though she may have some underlying comorbidity or underlying illness, she is very stable. In regards to contacts from this individual, we really are still looking at that, and I know that the personnel out there on the island, they're still doing their contact tracing as well. I guess I just wanted to highlight a little bit on what Dr. Manzanero had mentioned in regards to the populations who are most at risk. We do know that even though we're getting some information that the higher risk groups are indeed the elderly, that keeps changing and it's very fluid. So we're trying to see that now there are other situations in which younger individuals are actually being, they're actually ending up in critical care. We do know of a case in the U.S. where an individual who was a teenager actually passed away, very healthy individual, and who passed away. So we really want to stress that this is a measure that all of us should be taking when it comes to how we are going to enforce social distancing, self-isolation. So when we're talking about it, it's across the board. So that's for all age groups. So we are asking that everybody take into account these measures, and they should be enforced at all levels.
It says also here, do any of the traces extend to areas of the mainland beyond PGIA? We tested 2 people that were in contact with her on her way to the island, and those are negative. That's also something, just like people will lie to not be tested, I think somebody has lied to be tested, because now that we are trying to track the person, there doesn't seem to be any link, and I guess we don't have to divulge all the particulars of that case, but I mean the opposite can also happen, I guess. What do you all know about the chloroquine drug being mentioned in the international news? We are aware. We were in discussions with a consultant yesterday from PAHO, and again, even though it's published elsewhere, if it is done for the Belize context, it will be done as an experimental drug, and my desk will probably have to sign off on it because there is no specific heavy evidence that suggests that it works. And even if it is done, it has to be done on a controlled environment, so people should not be really having access to it. We did check who has procured it or who would have in the country, and the 3 suppliers that would routinely bring it did say that they don't have it in country. They're expecting it to come in. But this should not be sold unless it has a prescription attached to it. If you notice, it is the older generation may recall that it's used primarily for malaria. Are San Pedro people being tested that came in contact with the individual? I'll ask Russell to answer that. And then it says, how does San Pedro compare to what is happening at smallest Caribbean islands like Guadeloupe?
I can answer to the first question when it comes to who is being tested. When it comes to contacts of the first or the index case are indeed being screened. Remember, there is a measure of how we do testing. The testing continues to be anybody who has symptoms, presenting with symptoms, and is actually of a direct contact. So in this case, we are looking at those cases. The amount of samples that we did screen from these index cases are being screened as well, and we already have some of those results. I believe there is only 2 that have been pulled for today, so those will be entering into a new testing for later on this evening. But so far, the contacts they are being screened, and that's the way how we picked up the immediate contact as well.
What is the age of the second patient? I'll just say, I don't think we need to get into particular. You said it already, yeah. But again, there are other conditions that we might not want to discuss. We have to respect the privacy. She is a patient. We don't need to ventilate that for everybody to understand. How does San Pedro compare to what's happening at the smallest Caribbean islands like Guadeloupe? It can be a plus or a minus in the sense that when you have smaller countries like Guadeloupe, and if you notice all those other Caribbean islands, it may be easier for you to do contact tracing because you are in an enclosed environment. That doesn't necessarily mean that that's the way it happened in San Pedro, because some people have left. We understand that some people even are trying to leave in the middle of the night and docking up elsewhere, endangering their lives. As we understand it, it might not be as a result of the COVID-19. They're just trying to leave because they got trapped after the state of emergency was declared. So, in theory, that it can be a plus that you're able to chase it once you're on a enclosed environment, but it's not necessarily going to work like that. Just like when you have enforced lockdown quarantine areas, unless you're able to enforce it 100% of the time and people are willing to comply, it doesn't always work. And I think you can see models as to why that doesn't work everywhere you go. Are you testing enough to ensure your claim that there are no other cases or the virus was imported? Well, all of the cases we have had highly suspect cases. We even had 3 persons that were retested because we weren't sure. We have tested people. I think that this also tells us how much we Belizeans travel. We had people with links to Colombia, to Japan. Those have come out negative. I think starting through this weekend, starting next week, we're going to start to see screen others that are not just necessarily meeting that specific criteria we have. But it doesn't seem that we are having severe cases of acute respiratory illness, or at least the hospitals are not showing those numbers. Ventilators, I think I mentioned it earlier. 6 are coming in today or Monday the latest, and we are purchasing 20 more. Is there a reason why tests are not automatically given to Belizeans who enter Belize from a high-risk area? Well, those people that were screened have mostly been from high-risk areas. And we have locked ourselves out for the last week, so that's not necessarily a concern now in that regard. Why is the market open, and since law number 7 says they should be closed, and also why bars are still open? If that's a little confusion that we need to clarify. We did not say closure of the markets. If you read the quarantine measures, it doesn't say. It says that the markets may be closed, but they are not maybe closed, and there would be specific reasons. If markets are not complying, if they are all jumbled up in one area, I think we can use the example of the Belmopan market that was moved. It's now at the Agric Showgrounds, and there's lots of spaces. It's open area, ventilated. That can still work, because at the end of the day, the basic food products, especially if you're getting fruits and vegetables to boost our immune system, should be made available to people. Bars should not be open. I can't see. Well, I can think of a possible reason why. Yeah, but they should not be open. It's a quarantine situation. It's clear. I think you should make a report of it to the police. I mean, you have all measures that should not be happening. Are you getting technical assistance from Taiwan? Minister Marin has gotten funds. I think that was published in one of the press releases, and I think there's some material coming. I do know that we have gotten an invitation to participate in a virtual session very early Monday morning to discuss how their response has been and the experience from one hospital in Taiwan. Will nurses be getting paid hazardous allowance and be given a proper place to stay to rest since they won't be going home? Every region has been asked to identify areas, and I think all regions have said this is where you're going to stay. The hazardous allowance is something that I think is warranted, and not only that, I think frontline workers that are able to go and see patients should be compensated, incentive allowances and all of that. Of course, that's a process that we are going to lobby for all, and we have been lobbying for all of that, and that kicks in once we start seeing those patients. I mean, if you ask me, for example, the doctor in San Pedro who has been doing a good job of heading a team of contact tracing, he is also one of the frontline workers who has been directly exposed, so that needs to be compensated somehow. What is the monitoring assessment saying about cases of acute respiratory illnesses? I'll ask Russell to talk about that, the Ari and Sari cases in our report.
Yes, as part of our measure here from the unit at headquarters, when we talk about surveillance, you take into account different illnesses that are being managed on a weekly basis. And of course, in that, we actually follow what is acute respiratory infections and severe acute respiratory infections. Acute respiratory infections are all those who have some form of flu-like illness. We screen individuals who are under 5. That means if all children under 5 are screened in one in one way, and then we have others older than 5 and up. Those is another measure. And we do that for both the flu-like illnesses, and we also do it for severe respiratory infections. These are the ones that would be admitted to the hospitals. In regards to how we're looking at screening right now, you do remember that we're in the flu season. We are having an increase of cases. With that, though, we need to be very cautious of how we're managing these and looking at these cases. For example, we have seen an increase of flu-like illnesses in the past week. With that, we're actually trying to go down and look at more in detail where these cases are being seen at the district level. We can tell you that there is an increase nationwide, there is an increase of flu-like illnesses, but we need to pay particular interest to certain districts as well. Of course, that will be coming after, but we're still looking at individual district level data, but we are seeing increased cases right now. Do know that even with these measures, you should still be doing the same thing. Even if it's for influenza, you still need to be doing the precautionary, the preventive measures of the correct hand washing. You wash your hands completely for 20 seconds. You want to do the cough etiquette. So these things should not be changing. This is what we need to be doing. Of course, right now that we're doing for COVID, we need to, of course, maintain the social distancing and the self-isolation. We mentioned this to you so that there is a measure out there that all of us should be taking, and this is part of the responsibility that each one has. So indeed, this is what we're seeing, and I believe that these increase in cases might continue to be seen in the coming weeks as well.
It says how about azithromycin, that's an antibiotic, also should not be sold unless there's a prescription, and there's only preliminary data that it seems to work when combined with chloroquine. Again, that would have to be done only in conjunction with a physician. People should not be going out and buying azithromycin because it is not prophylactic. It doesn't mean that if you take it, you won't get COVID-19 or your symptoms will be less. And I think we can use the example of what's happening here with the 2 cases in San Pedro that are not getting any specific treatment in that regard. ¿Cómo se encuentran las personas afectadas? ¿Están mejorando como su estado de salud? Bien, con buena evolución, sin síntomas mayores a los de una gripa común y corriente. Can it be possible if someone who has been tested negative can later become positive? I think we had said that can happen. It has been documented, but we are not so sure whether that's a reinfection or whether the person never really actually got over the first infection to begin with. Will persons that fail to report if they are sick be charged too? If you are COVID-19 positive eventually and you, I think the Quarantine Act also articulates what it is that you're supposed to do if you have a travel history or you were in close contact with somebody who is COVID-19 positive. Your obligation is to self-isolate and report once you start having signs or symptoms, or even report if you have been a close contact. We have actually screened people who were in contact with COVID-19 positive cases, and we have not been, even though they are symptomatic, they came out negative. Interferon, is it available in Belize? We don't have any in stock. We are also looking at that option. Again, as I said, WHO, just in discussions yesterday, said these are all experimental drugs. Are they checking those that enter the country? Yeah, those are still being monitored and asked for follow-up as we're coming along. Are data being made available to indicate underlying health issues in young people? E-cigarettes. E-cigarettes and vaping are concerns in the U.S. and actually the younger generation that is now started to die in the U.S. has been linked to the use of e-cigarettes. We haven't seen the use of e-cigarettes being a common practice in Belize, but we have cigarette smoking and other issues such as cannabis, marijuana, that can put you at a higher risk, and that's been documented because there's already damage to the lung tissue. So you get COVID-19, you have even more respiratory compromise in that regard. People who come in contact with patients here in isolation, do they need to exhibit symptoms in order for those people to get tested? They got tested. The immediate first contacts, I think it's total of 6, and they are in isolation. They would need to be retested 14 days after the initial swab, which was earlier this week, and they need to be negative in order for us to consider them to be negative completely. That's clearly outlined in that follow-up. Do you think state of emergency should have an open window daily for grocery shopping? Well, I would have to go. I don't know what the legal issue is in terms of declaring a state of emergency, but in other places where there has been a lockdown, it does mean the entire system shuts down. It means that you need to have your pharmacy open, your hospital needs to remain open, your gas station needs to remain open, your food supply needs to remain open, but you are not supposed to be all out on the street doing shopping at the same point in time, nor does the entire family need to go out. You'll need to designate somebody who can come out and do all of those for that one person. That's what's happening in other places. Again, when you look at the models and mathematical models, it suggested that if you have 1/8 of your population only moving, because in order to maintain your basic essential services, you're going to have the delivery trucks that need to deliver your water supply and ensure that your electricity, your water, your cable, all of those things are functional, your phone lines. Mathematical models suggest that 1/8 of the population moving is a good enough number in terms of a lockdown. It doesn't mean the entire population needs to stop moving at any given point in time, because things are going to continue to happen. Because even in a lockdown, we're still going to have to find a mechanism of ensuring that the healthcare workers and other essential services are able to get to and from their place of work. Persons on San Pedro that want to go home to mainland, I know this is a very tricky situation, because I know people got trapped on this side on mainland, and some people got trapped in San Pedro. In discussions with the bigger group in the task force, we did say people who want to go to San Pedro, that's perhaps the easier situation. They should be allowed to go back, understanding that they need to go and self-isolate because they are going to an area that has had a case or two cases. And how do you get the people that need to come off? We have been screening them on a daily basis, particularly people who have had health issues that need to come here. And I think yesterday, for example, there was 15 or 16 people that were allowed to come to Belize. We have also said that we may have to look at this on an individual basis, because it seems that up to 1,000 people, some preliminary numbers, are the ones who want to come on. Ideally, you would want to keep everybody on the island for the next 7-10 days, because that's from when the index case was identified, was 7 days ago. A swab to now is 7 days. Give it 14 more days to see how that is going to pan out. That's the ideal situation, understanding that there are people who are, this is where home is, wherever it is, but pregnant women, for example, came off yesterday. Somebody on dialysis came here. People having congestive heart failure, those things are easier, provided they are screened before they leave and they are screened upon arrival here. So in terms of opening it all, that's the trick situation in that regard. Why hasn't another hospital been allowed to do the test for the virus? I don't know. I think we have screened everywhere. We have picked up swabs from Corozal, Independence, Punta Gorda, Belmopan, private sector. I know Healthcare Partners, we have a very good discussion with them. Carl Husha has been sending. So people swab and they send it to one lab. We only have one lab that has the capacity to do that. And I'll ask Russell to also discuss the other mechanism we're looking, instead of rapid testing, what other mechanism we have other than PCR testing, which is what we are doing now. Would a complete shutdown, except for essentials, help in containing the virus? It does. I think we have done lots of shutdowns now. Some communities more than others. Maybe it's the time I go home, but from going from here to Sokots, everything seems to be. It seems like ghost villages, ghost towns going home, and all stores seem to be closing at 5-6. Shutdown is, essential services will need to remain open. I think we need to stress that shutdown doesn't mean everything is shut down. Will any Cuban doctors be deployed to San Pedro? Depends. We are going to analyze that. I have to stress that Cuban doctors are currently under quarantine. They are not again, that's part of the precautionary measures we are taking in terms of that. So, Russell, you want to talk about the other tests that we are potentially looking at doing?
Sure. Currently, what we do have in place is that we only have the Central Medical Laboratory in Belize City that is doing the certified PCR testing for COVID-19. We have no validated rapid test in the country, so CML is the only certified laboratory to actually conduct certification for COVID testing. We do indeed are looking at other ways of testing. We do know that there is another source of potential testing in the near future. I know these are discussions being done in the regional level. We do know that the gene expert machines that we have in country are currently being used for testing for TB, for tuberculosis. So at this point, there has now been further investigations and research, and we're now able to look at a potential source of testing for COVID-19 as well. This is actually being looked at to see how we can actually, besides testing for tuberculosis, for COVID-19, of course, the turnaround time for that would be shortened by half. However, these discussions are still in the process. It is not being marketed to everyone, so it is still being in discussion globally. So we're going to see which countries would be the ones actually accessing those testing kits. Of course, we do have the machines in country, so we have the capacity to run those tests. However, we still need to engage in discussions with our regional stakeholders as well. So I guess for testing, that's another source that we can look at afterwards as well. And of course, we have reached out to our Director of Health Services to discuss that kind of testing. And of course, if we have the capacity to do it, we will be looking at that as well. Outside?
Yeah, to CDC.
No. I'm being asked, are we doing any kind of, I believe this is a question for quality control. Are we doing any quality control of the samples being pooled right now? Indeed, this is something that we have been in discussion with the central laboratory as well. Of all the samples that we've been receiving, we do have pooled already 86 in all. We will be sending out the 2 confirmed cases, and we will be sending out samples of those negative cases as well to CDC in Atlanta. I think what we're waiting for is to see how we're going to get the processing and the packaging of those out of the country. Granted that we have no flights coming in, so we're trying to look at that modality to send that out.
I think they're asking, you already gave me the wrap-up notes. If you have quarantined yourself for 14 days, then go out about my business in public. Do I need to be quarantined for another 14 days? That's a trick question. I assume you're placed on quarantine because you are coming from an area of interest or in contact with the index case. After you have gone and you're asymptomatic, I think you're pretty, unless you go back to an area of interest or go back in contact with somebody who has been diagnosed as positive, then your quarantine starts over again, and you will maybe forever be under quarantine if that continues to happen. But I need to say this because we are in this for a long haul, and we are not trying to cause panic to anybody. But I was looking at the modeling that the Mexicans are doing, and that's the one I follow a lot. And the U.S., of course, but those are the closer ones to us, to our reality. They are not thinking that they are going to come out of their curve, and we don't have a curve. Maybe the next session we're going to explain with what flattening the curve means for people to understand where we would want to go. They are not thinking that they're going to come out of any curve until the middle of November, and that's when the flu season is routinely on for them, so that they are saying, you're talking about the next 18 months of your life changing as a result of COVID-19. So this is not just the next 2 weeks. I mean, whatever measures we are taking now that will remain for us forever. Recent studies of American universities have showed that COVID-19 can live on fruits and vegetables for some hours. Can you confirm that would be the case? Which is why we're telling people, if you are ill, not just for COVID-19, you should not be sneezing up into food and stuff like that. You need to wash your fruits and vegetables routinely with the way it's supposed to be done. What is your response to the fact that San Pedro residents and businesses are not practicing the social distancing and other regulations? Today it looks almost like pre-quarantine, and this is something that has come to us 2 or 3 times today. Again, folks, we are asking for a collaborative approach in terms of society really helping us in ensuring that we are doing what we are expected to be doing. If people are having issues with the way the health system is structured, if people are aware of the challenges that the health system has, then I don't think the criticism should be the fact that we don't have a ventilator. I think our role has got to be, well, I want to make sure that I don't ever need a ventilator, if that's the take we're going to take. So that can only be done if we start to take personal responsibility for our actions. What is the current number of doctors and nurses in Belize, including the Cuban Brigade? I don't have that off the top of my finger. In terms of doctors, I know it's 400 plus. And in terms of nurses, I think the total amount is about 2,000 plus if you include Cuban doctors and nurses. What kind of compensation will be given to any frontline worker in the event of death? Will their families be taken care of? I think this becomes applicable in terms of what can be done in terms of government as a public officer, what you would be entitled to. I think the issue with Social Security Board is being looked at as what potential benefits you are entitled to. So that's being looked at. The bus station, how likely is it for someone to contact on public transportation if there is no community transmission? At this point in time, the risk seems to be rather low. So I know that the recommendation has been that public transportation sanitizes the bus properly after the passengers have come off, and you even go and sanitize your area when you're going to be boarding a bus or after you leave the bus. Again, that's not just for COVID-19, and that's the trick situation, because I was reading an article as to how the airline industry, for example, is going to change as a result of this. And you know that the concern was always that airlines were getting tighter and tighter in terms of their space so that you can accommodate more passengers. So even that will have to change. So even the enforcement that we are doing in terms of sanitizing the bus, sanitizing all these other areas that we come in contact with, I think those are not just for COVID-19. If we are saying that for the next 12 or 18 months it's going to happen, I think it's going to be the norm as we go along in that regard. I lost my question somewhere in technology, but the other situation that we are looking at for everybody is we had also engaged in discussions with other labs to see what kind of support we can get, even in terms of supplies, because I know we were running low on some supplies, but the issue is also the fact that the Guatemalan border is closed, and that's the reason why we couldn't get the supplies here. So that's something that we are looking at. Fortunately, the cargo situation in terms of PPEs, masks, and all these other things are still coming because cargo is not affected in that regard. What about the next virus that is out again? Can you explain about that? The hantavirus? Well, this I think is the second or third time that we have heard of outbreaks of hantavirus. Again, the One Health approach, because more and more viruses are going to be jumping to the human species. More and more of these diseases are expected to come about the more and more we invade forests and animal spaces. So that is anticipated to happen as we go along. Do you run all tests immediately? It depends on where you take the sample. We had initially said 4 to 8 hours. 4 to 8 hours is after it has gotten to Central Medical Lab. But if you are swabbed, then that sample needs to be transported to Belize City, usually by road. When there were planes flying more regularly between Dangriga, Independence, and Punta Gorda to Belize City, it was easier. So that goes by road. As soon as there's a suspect case, we are alerted and we alert the lab so that they start to prepare for that. If there are samples coming at any one point in time, then we run it as a batch at Central Medical Lab. So once it gets there, the extraction process and everything that happens, it can come up to 8 hours. So what we are routinely asking people for is to anticipate a 24-hour turnover time before you get any result. And again, that's the screening, because if the screening turns out positive, then there's another test that will be done to confirm that, so the process will be delayed a little bit longer. So why should I run to the doctor if by chance you get a fresh cold or flu if I haven't come in contact with a person with COVID? I think we are saying that you shouldn't necessarily run if you can call us ahead of time so that we can make preparations. All major facilities have now a flu area where you will be sent to and screened. Screening doesn't mean just the swab, but also a question and answer, the usual clinical history, and a physical exam to determine what level of risk you have. After the infected test negative, will their homes not be heavily infected? The virus lived for 17 days on that cruise ship after they evacuated. Well, that's part of the process that we are explaining to people. Once they're in isolation, is the cleaning processes and procedures that need to happen to ensure that this doesn't happen again. Can you give a breakdown of the newly arrived medical personnel from Cuba, GP specialists and nurses? Will they be distributed throughout the country? I don't have the breakdown with me. I know the other flight comes in today, later on today. I know there's doctors, there's nurses, there's general doctors and internists that are coming there. There's lab people that I saw on the list. I think there's 1 or 2 epidemiologists that are on the list as well. That would help us on the work that the EP unit is doing in that regard. Will they be distributed throughout the country? Initially, this is primarily thought of to be in Belize City. Contingent on how this evolves, they can be deployed to other areas. I mean, depending on where your response needs to be. If you can, again, if it pops up anywhere else in the country, then your resources and your mapping goes to that specific area. And I'm being told this is the final question. Can you share what kind of personal care the 2 patients are getting? That is, how many people are taking care of their basic needs? Well, they're isolated. We are following what is recommended everywhere else. I mean, if a patient doesn't routinely require any health intervention, then you minimize your risk of not sending in staff to see them. So one modality we have adopted with them is FaceTime. So they're called, they have been given a thermometer, for example, and they will monitor their blood pressure, and that's sent on to the health care provider, and they are at home in an isolated area where they're basically, I mean, remember, this is the normal flu in that regard. So I think that's the last question. I really want, I think, to thank you for following. I think we have to thank you for not spreading false rumors, for ensuring you take the proper information. I must say that the media houses have really been working very well with us. I mean, they don't air anything unless it comes up to us. You are aware now of the person who was charged for spreading a false rumor, and that will continue to happen. I really think it's important that we as society do whatever we are supposed to do. Through the weekend, we should be having another interaction. We'll find a mechanism of doing it wherever we are. We should perhaps do one in Espanol for this weekend. And for further information, folks, it's going to come through the Ministry of Health official page, the Office of Director of Health Services for an official page, and the Government Press Office. There is a website now, covid19.bz, for information, where we have our little counter in terms of number of cases, and we intend to map out also where all the samples have come from the country, so that you're aware of all the areas we have done actual testing from. So thank you very much, and do continue to remain safe, wash your hands, don't touch your face, speak to people at length, and maybe we should be minding our own business as well in terms of with our neighbors. So thank you very much.
Get information from a respectable international or official local source. When in doubt of COVID-19 information, verify before sharing or repeating the information.